What's up, guys? Chris Shear here from Kinetic Physical Therapy. And as you learned from a post or so before on Instagram, October is National Physical Therapy Month. Woohoo! And not just because I'm a physical therapist, but because I know that, as I've said in previous posts, is that a physical therapist is the most qualified person to evaluate your movement-related pain, hands down. And I wanted to take the opportunity over the course of this month to talk about some other professions in contrast to how a physical therapist can be more helpful. And this is no slight against those other professions. It's simply just in favor of the profession of physical therapy and the tools that we have and the evidence that we have to treat your movement-related pain. So today, I wanted to start with your primary care physician. And listen, I have a great primary care physician, and he listens to me and he talks me off of ledges, and he has a great skill set. I feel so very comfortable with him, and that's great. And that's the kind of relationship you should have with your primary care physician. But it's also the kind of relationship you should have with a physical therapist. Let's talk about the way, let's say, low back pain, acute low back pain is treated in general right now. As we sit here, what would happen if you acutely sprained your low back or strained your low back? Well, I can tell you most people would probably call their primary care physician. And, they may or may not be able to get you in today or tomorrow. And, every practitioner has tried really, really hard to close that window of time people have to wait to get an appointment. So, kudos to everybody for speeding up that process. But let's think about the interaction that you would have with your primary care physician. You crawl in, someone would push, pull, or drag you in to your primary care physician's office because, let's face it, you just strained your back. And once seen, there are only a couple things that can come out of that. Now, if your primary care physician is a DO, an osteopathic doctor, he or she might choose to manipulate your back, which we have the evidence for to support that in many instances. Not everybody's a candidate for that, but a large percentage of people are. If you fit a certain clinical prediction rule, it's beneficial, more beneficial you receive that manipulation than you don't. But you may or may not get that treatment from your primary care physician, and then you think, all right, so what's the next thing he or she can do for me? More than likely, they'll fill out a prescription pad. They'll ask you if you want some pain medicine, and there's a whole other post that needs to be done with regards to the opioid epidemic in the United States. So nobody wants that. I mean, we see people all the time who say, hey, I want nothing to do with the pain medicine and the oxys and whatnot. And that's good. We don't want you to take that. The next thing, they'll give you maybe some anti-inflammatories, a higher dose of Advil or Aleve, a prescription dose of those two medicines or something like that, and or muscle relaxers. And most people I speak to don't really like the way they feel on muscle relaxers either. So they opt not to. And so what happens is that, again, the next thing they can do for you is, well, maybe we should get an X-ray and just kind of see if we can see anything that's going on in there, or even, more so, let's get an MRI and see what's happening. And what we've learned is that, the degenerative process, no matter what joint we're talking about in your body, the degenerative process starts when we're 20 years old. You likely aren't having pain. But that being said, if we MRI'd or X-rayed 20-year-old spines, we're going to see some evidence of some early degenerative changes. And so if you're a 44-year-old dude, you're going to see some degenerative change. And what our research has shown us is that there's no correlation between what you see on an image, the changes that you see on an image, and a person's pain level. So people with full thickness rotator cuff tears can have no pain at all, and someone with a very small rotator cuff tear can have a tremendous amount of pain. Same thing goes for people with low backs. If we MRI'd 100 people with low back pain, 50 pain-free people will have herniated discs and degenerative changes, and the other 50 people will have those same things, but 50% are going to have pain, 50% are not going to have pain. So, like I said, the asymptomatic people have those same changes. So we just call them wrinkles on the inside. I'm not sure people really love to hear that they have wrinkles on the inside, but it is it is true. I mean, it comes with being 44, and the same thing happens at my spine. So the only other alternative then, unless you're on board with, yeah, doc, let's get an MRI, then after that, let's potentially get some injections, or let's go down the path of other pain management. He or she's going to order physical therapy. And the fact of the matter is, a physical therapist, a manual physical therapist, someone who's trained to identify, especially for low back pain, who's a candidate for manipulation, who's not a candidate for manipulation. The physical therapist is the shortest trip to pain-free living in this instance. Okay, so if you're able to get in, like I said, in a day or two to your primary care physician, that's great. But how long does it take to get that X-ray? Maybe another day or two or three. How long does it take to get that MRI? Maybe another day or two or three. And you're given some medicine potentially, and you're told to lay low for a while. And that's just not the way. That's not the way we've learned that low back pain in particular needs to be managed. We need early motion, and we need an educated set of eyes and ears and hands to be able to perform the correct treatments when they need to be performed. And so, again, I'm not here to slight the primary care physician. I already told you I love the relationship I have with mine. That being said, if I sprained or strained my back, I know that the best person to crawl in front of to alleviate my pain is a doctor of physical therapy. That professional can treat you day one. And we've seen it happen in our clinic. We've had people literally filling out their paperwork. Yes, I'm sorry, there are some paperwork that has to be filled out. But you guys are used to that by now. People are laying on their stomachs, filling out their paperwork, and because they can't stand up because of pain. And they walk out of the office because we were able to perform the appropriate maneuver and procedure. And more than anything, after visit one, you get a strategy. You get a diagnosis. We educate as to what the problem is, and more importantly, you walk out of there with a strategy of pain relieving techniques to be able to start living more pain-free or decreasing your pain immediately. You don't get a prescription to stand in line someplace else. So for this physical therapy month, if you're dealing with any nagging ache or pain, it doesn't have to be even acute low back pain. If maybe you're suffering from chronic low back pain, maybe you've had low back pain for years, don't feel like you're just bound, you have to live with this, all right? You don't have to live with chronic pain. There are things that can be done for chronic low back pain, neck pain, whatever pain. But in this context, especially for low back pain, you do not have to just decide that, oh, I guess I'm just going to have to live with this pain. No, you don't. Forge a relationship with a physical therapist, and he or she will take great care of you and will teach you how to manage and decrease your chronic pain. So chronic and acute pain sufferers, please start with your PT. It's the most efficient way to enter the healthcare system in treatment of almost any musculoskeletal pain. And so on this first video dedicated to National Physical Therapy Month, go see your physical therapist. Like I said, no more lines to stand in. We'll take people within 24 hours, and we have direct access, which means we can see a person without a physician's prescription for 30 days, and your insurance covers it. So do the best first step for you and call your physical therapist. All right, stay tuned. Thanks for listening.